Buenos días. It's great to be here. And I want to thank my mom taught me that it's always good to say thanks, where thanks go. And certainly to Karen Calhoun and Adam and also Mark for this really kind invitation. And I'm this is very inspiring, let me tell you. This is just fantastic. I walk around and see the energy and see, you know, the incredible diversity that you have, and it is very inspiring. I also walk through the poster sessions, and I was reading at least the titles and some of the charts, and it is just terrific work. So it's a pleasure to be here. Thank you so much for the invitation, and to do it with my friend and colleague Al, that we co-chair at the national level, the Community Engagement Key Function Committee, is just a treat. Who knows? This might be the beginning of us being on tour. We'll see. We'll see how it goes and how the day ends. Okay. Well, I want to share with you some thoughts about this idea of developing community academic partnerships for improving health. And the comments are going to be kind of general, kind of the 30,000 feet. I would love to get in more details, but then we're going to have kind of a question and answer session that perhaps in that segment I can provide a little bit more examples. But let me tell you, I have no question that the bottom line of all of us here is enhancing the health of our communities, locally and nationwide, and reducing health disparities. And there is a key ingredient, and that is community engagement. And what I would like to do is just to touch base with you as to why we want to engage communities, not something that you know, I'm sure, better than me, perhaps. But there are some thoughts related to that. One is that community engagement is a cornerstone of effective public health practice. There is no way that we can do a dent to improving community health without communities. Also, community engagement builds skills and capacity within the community. Communities are essential for looking at long-term, sustainable efforts, and also for reducing disparities. Crucial also on the work that we academicians usually do, which is the recruitment and retention of those who participate in research, both in clinical trials research, but community-engaged research as well. But more importantly, this is where the, with the buck stops. It is in communities when the work that we're trying to do is fully realized. This is a definition of community engagement is the most commonly, widely used definition coming from the CDC, the Centers for Disease Control. And they refer to community engagement as the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations, and this is the key point, to address issues affecting the well-being of those people. So one of the key ingredients of this definition is to have a finger on the pulse of what matters to communities. Then community-engaged research, which is this community campus or community academic partnerships. This is a concept, community-engaged research, that has been around for a long time, and it has taken different names. When when I was in my PhD, we used to call action research, and it has gone through several iterations, and currently the one that appears to be used is this notion of community-engaged research. And it is a framework for conducting research, and it may incorporate different types of research, qualitative, which is of critical importance, and quantitative. One is focus groups or doing doing interviews with cultural brokers or key informants, and the quantitative, doing surveys, quantitative surveys. Also recognizes and builds on community strengths and assets. It's not just to go and ask communities, what are the concerns, what are the deficits as well, but also to look at what are the resources that they bring to the table. Also characterized by principles that guide the research. We have been working on, as I'll very briefly tell you about some of the work that we have done at the national level, which is to come up with this second edition of the Principles of Community Engagement that identify 9 principles in which this work with communities, and it is with communities, not on communities, what that involves. And also, it requires partnership development, cooperation, negotiation, and collaboration with community partners, and a commitment for what matters once again to communities at the local level. So community engaged research builds community capacity by identifying problems, developing and applying solutions. One of the key issues is this shared decision-making power, and in a minute I'll put it more in context, and then to share dissemination of data. And the most important part is that this implies that there is this a strong partnership that takes time, attention, and reflection. I had been doing community work for quite a while, and it is very time-consuming, but it's incredibly gratifying as well. Because it is about relationships. Most likely you are unable to see it, especially on the back, and I decided to put this just to test the vision of those of you on the back, and that maybe it's time for you to go and do a eye check. If you don't read this, it's time to go to your optometrist. But no, actually, this is these are different levels of community engagement, and it goes and it is related to what extent there is a development of trust and the level of involvement that occurs. That goes for the most simple one, which is just doing outreach, and having communities as passive recipients of information, basically, all the way to consulting, involving the communities, collaborating the communities, and then shared decision-making, shared leadership, which is the hope that many of us would like to see happening in these community academic partnerships. One of the things that I have seen happening as we engage with communities is that still, unfortunately, there are academic centers that see communities as the source of, participants, research participants. And they engage with some communities to get as still people called subjects of research. Well, we have to do much better than that. And we need to engage communities in the whole research process, right from formulating the research questions or whatever we are hoping to study, and involve them in that formulation all the way to the design, the implementation, interpretation, and evaluation of the research. And this is one of the things that we have been trying to do at the national and at the local level. Very challenging because it requires an institutional cultural change, especially in academic settings. You get it. I have no question about that. And it is a matter of to what extent, academic settings and academic partners get it as well. So we must restore balance to the academic community academic partnerships. So there are benefits of community academic partnerships. One is that science benefits from practical research, grounded, sometimes grassroots research. But also the community benefits from evidence-based sustainable programs, and that can go both ways. Actually, that's what we're hoping to develop, these bi-directional communications. And then this is related to better health, better outcomes, and lower cost. This is the triple aim that Don Berwick has been disseminating everywhere, which makes a lot of sense, and that now health systems are striving to reach out. So at this point, let me tell you a little bit about the CTSA Consortium. How many of you have heard about the CTSAs? If I just, okay, a good number of you, but the majority of you have not heard by your show of hands. CTSAs stand for Clinical and Translational Science Research. And this is a initiative that Congress authorized for about 10 years ago for what is now a consortium, as Karen mentioned, plus 60 academic health centers who are a part of this national consortium. The primary goal is to speed the process of translating basic research discovery into clinical application, clinical practice, and ultimately improving community health and reducing health disparities. One of the things that the CTSAs do is to create basically an infrastructure and provide consultation, technical assistance, and critical tools and resources to ultimately improve health. And there are about 61 basically CTSA sites in 30 states, and this is at a cost of about $500 million a year, that money that comes from NIH. This is just an example of all the states that have one or more CTSAs in them. As you can see, a good concentration of those are basically on the northeast of the US, but they are quite spread out as well. The CTSAs provide a foundation for clinical and translational research by providing a specialized infrastructure support, engaging community partners to connect with researchers, and then training the next generation of clinical and translational scientists. Every single community, CTSC has a specific course, and one of them is education and training. And the idea is to train the scholars that are affiliated with the CTSAs, not only on how to do better research, sometimes clinical trial research, but from our perspective is to do a better community engaged research and understand the communities in which they are going to be working. So there is a sharing vision across the consortium, and that is working together, share this vision to accelerate discoveries toward better health, and this is by transforming the research and training environment to enhance the efficiency and quality of clinical and translational research. This is initiative at the present time is led by the National Center for Advancing Translational Sciences, or NCATS, at the NIH. There are 5 strategic goals that the consortium is focusing on. As you can see there, I won't read all of them, but I will focus specifically number 4, as we call it, the strategic goal 4. And community engagement is the specific strategic goal that we are working on, and that is enhancing the health of our communities and the nation. The mission of the strategic goal 4 is to both improve the public health and reducing disparities, and promote and disseminate the translation of results of often cutting-edge research that is being done. One of the challenges actually that we have is how to translate effectively and communicate and disseminate that information effectively to those who stand to benefit the most from this research, and also to identify and develop effective partnerships. Then, related to the strategic goals, there are different key function committees. One of them is community engagement, but there is another one called evaluation, education and training, informatics, communications, etc. And the specific goal and the main focus of the Community Engagement Key Function Committee at the national level is to effectively engage communities and practices in translational research, and as a consequence, improve the health of communities and the nation, and reduce health disparities. And I keep saying that over and over again. But indeed, that's one of the things that we're hoping to do. The main areas of focus include community and practice outreach and engagement. And by practice, we mean working with community-based practitioners, that in some instances, they have gotten together in networks that are called practice-based networks. And these are places in which the academic health centers are interested also in doing research through practice-based research networks. So it is community and practice outreach and engagement, access and dissemination of best practices, and to do this, once again, in a bidirectional manner. These are some of the things that we have been able to, the accomplishments that we have at the Community Engagement Key Function Committee at the national level. One is these principles of community engagement. This is an edition that came out, originally, that the CTSA published back in 1997, and this is the second edition. And there are a lot of folks and a lot of agencies work on this edition, and we have it in English as well as in Spanish. Also, until recently, we have had a community engagement consultative service that allows different CTSAs across the nation to consult with other ones. So, for example, the first consultation that I gave was at Duke University, but I have done it in Rockefeller, in the University of Minnesota, etc. It is to, be able to exchange ideas and exchange plans, and to be able to also provide honest feedback. Also, there is this other resource that was primarily developed by the University of Washington called Primer, which has a lot of very useful tools when you are working with communities. All of these have their own websites, and if you just Google it, I'm sure that you will find these resources. Just to give you a very specific example of a community engaged research at the national level, we have, in which we are using community health workers, we have what we call the Sentinel network. And by the way, the University of Michigan, MICHR, is a partner in this effort. And basically what we do is to train community health workers to engage with primarily from underserved communities, and then to collect demographic data, top health concerns, and to identify barriers on research participation, and to take the opportunity to educate also the communities in terms of the importance of research. This is a ways of enhancing the public, enhancing the trust of the public in terms of scientific research. And most recently, what we have been providing referrals to agencies and clinical trial studies. Just to give you a sense, one paper, we published a paper recently with the findings, and reaching out to hard-to-reach populations that traditionally have not participated in clinical research. And what we found is that even though only about 11+% of those that we went and interviewed with had participated in research, about 85% of those would be interested in research. And then we asked different scenarios, like would you participate if you were to give blood or a genetic test or spend the night at the hospital, or a series of questions. But the strong message is that, yeah, they are interested in participating in research, but they haven't done it, So that's the message of the Sentinel network. You have your own, wonderful work here at here in your collaboratives. I was so pleased when Karen shared with me a very clever, innovative idea about what is called deciders. You guys are great for acronyms, for names. It's just terrific, the work that you do. And this is I'm looking forward to see the outcome of this, which is to really develop evaluation tools that would allow to go to communities and have a finger on the pulse as to what are the concerns that they have and what are the solutions as well, learning from them directly. So we have, of course, many challenges, but I will summarize the challenges that we have at the national and at the local level in terms of people, that we don't have enough community engaged researchers in our CTSAs. We need to prepare many more. Also, something that is of critical importance, and we are tackling, focusing on this, is the metrics. What outcomes should be measuring, and also issues that are of critical importance to community-based organizations and also for academic settings is sustainability. So this is outcomes that matter, matter to who defines the outcomes, who benefits, wrong turn, as I have seen it, and also how do we know when we get there. But the bottom line of all of this definitely is what matters to communities, and how can we partner to improve what matters to them. This is a very complicated, we call it logic model, that identifies a specific metrics, specific measures on, and this applies to the large collaborative at the national level that our colleagues MICHR and Carol Ferrance and others had been working on for a while. And there is a paper and the review that deals with these inputs, the short-term results, intermediate results, and the long-term results, which is looking at how to improve health. So this is my last slide. There are some things that I just want to summarize and leave you with. And the first one is that that there is no question that there is a growing community engagement interest at the national level, driven by an understanding that some learning, teaching, and research goals can only be achieved through collaborative relationships with local and regional communities. Also, that academic health centers have a responsibility to contribute to the public good and their surrounding communities. There is an increased recognition that this is the case. And we have a long ways to go, let me tell you, from the academic perspective, but I think that there are bona fide efforts and real attempts on you know, really learning how to partner better with communities. And use new funding to train, build, and support community-engaged research and patient-centered research. And yes, we are all on this together. So with this, I'm going to stop. And Karen?